Hi, I'm Dr. Bob Newhalfen of Northwest Indiana Chiropractic, and today we're going to talk about the open scissor position, or what many people like to see as anterior pelvic tilt, or your pelvis pointed forward as well as your ribs pointed up. So in babies, what we like to see and what you see in most babies is that the pelvis, or where my belt is, points directly straight, and the bottom of the rib cage, or like the xiphoid, which is the bottom part of your sternum, also points forward. But as we get older and we sit and we become very deconditioned in our core, our glutes, and our hamstrings, we tend to, or things like babies happen, a lot of people start to get into what's called that open scissor position, where their belt drops down and it starts to look down at the ground and the ribs come up. So instead of being parallel, which is normal, they start to open up. And if you look at my back, so if this is a normal position, as I open that scissor, you see how I get this like cave here, this valley with a lot of tension here. So as we go into that open scissor, what happens is we compress our spine a lot, which can lead to back pain. It can lead to things like disc bulges over time, and just a lot of different issues. So we see most people that have low back pain or hip complaints, even other things up into the neck, a lot of people have this open scissor position. And so it's one of the first things that we look for and that we work on correcting. And a little test that you can do at home is just, again, put your fingers at your belt buckle and the bottom of your sternum and just see if they're pointing straight. If your belt looks like it's pointing down or up, you're either in the bottom, the top, or you have both ends of the open scissor. And one test you can see to see if your brain understands how to fix it is if you take your belt and say it is looking down, if you start to lift it up, or you do what's called a pelvic tilt, a posterior pelvic tilt, and ask yourself, are you using your ab muscles, your glute muscles, or some other combination of that? What you should be using to create that pelvic tilt is your lower abdominal muscles. So a lot of people will use their butt muscles, or they'll use their back muscles, or they can't do it at all. And that is a big problem when it comes to functioning in your everyday life. And so again, if we take a look at, this is a little patient brochure that we give people. So if you can zoom in on that, you can see this person in the red is bad. So red is bad. We want to be the person in the green. So our diaphragm, our bottom of our rib cage, and our pelvic floor are parallel. And we see a lot of people with this open scissor position, which leads to a lot of compression in the low back and can lead to all kinds of issues. So again, if you find that you're somebody that has this open scissor position, and you have problems correcting it, or you want to do something about it, give us a call at Northwest Indiana Chiropractic. We have offices in Schererville, Crown Point, and Popo. Our website is NWI chiropractic.com. Dr. Bob Newhalfen, thanks.